In this video, we'll be reviewing WD's clinical decision support features, focusing on real-time red light, green light quality care assist depicted here. This system verifies if the provider's documentation conforms to the care standard before the clinician closes the medical note. This allows for on-the-job learning and, in some instances, life-saving corrective action. If you recall the case of Tums, up to this point, WD has supported the provider's decisions mostly through use of one of over 250 interactive clinical checklists. For this severe malaria checklist, we see 1. A concise background of the suspected disease or condition. 2. A differential diagnosis. It's possible this is not severe malaria. 3. Visual decision support, such as places in the world where one can contract severe malaria. 4. A focus on history and physical exam elements consistent with the diagnosis. In this example, WHO criteria for severe malaria are explicitly listed. If you don't have one of these signs, you don't have severe malaria. 5. Recommendation of studies to perform to support the chosen diagnosis. And 6. Automatic dose calculation of essential medicines such as antibiotics, glucose, or antimalarial. At the bottom of this and most other WD checklists lie 3 quality care assist rectangles. These rectangles light up green when the provider has successfully documented evidence-based care with regards to diagnosis, treatment, and patient education. In the case of Tums, the system is saying that the diagnostic criteria for severe malaria has not been met. By clicking on the rectangle, one can see why. Here, the diagnosis of severe malaria depends on a history of fever, a history of a severe symptom, one of the WHO severe signs, and either a rapid diagnostic malaria test or a blood smear confirming presence of the parasite. Notice the user has done both. Because both tests have been already performed, the clinician won't be able to initiate corrective action. Still, the feedback will help facilitate the right diagnostic choice the next time around. First, because WD users don't like to conclude documentation with red marks, and second, because individual performance on this indicator will be incorporated into the overall health statistics of the facility. Let's look at the quality treatment square. The system is saying that the treatment criteria for severe malaria has not been met. By clicking on the square, we see where is the deficiency. The patient has not received antipyretic. The patient also has not received any type of fluids, despite being hypotensive. So the clinician would go back and administer fluids. Let's give lactated ringers because it's in stock. The correct dose is recommended and will administer. Similarly, the patient has fever, so we choose acetaminophen since it can be given through the IV and this patient is unconscious. We select the route of IV and we give a single dose. Finally, we see the patient education square. The system is asking to review the disease and course with the patient and family, to answer any questions, and to reassure and support family members. Doing this turns the patient education square green. This concludes review of WD's clinical decision support features. WD attempts to provide intuitive, convenient decision support to the clinician while he or she works. This allows for on-the-job learning, prompt initiation of essential diagnostics and therapies, and even life-saving corrective action.